Hello everyone, I am Ritu Sani, member of AMPT. Today I am here to giving my feedback related our latest webinar of cranial neuromanual therapy for cranial nerves. This session was beyond our imagination, and because in this Dr. Santhil P. Kumar sir has shown us a great view how we can give the neuromanual therapy for the cranial nerves. In this all we have to check the mechanical stimulation with the help of tunic fork. We have used this. Sir has shown a great view how we can use a tunic fork at the proper place. So all the cranial nerves, like first we have started our session with olfactory nerve, where sir has shown how we can palpate the nerve with the, we can check the tenderness by palpating the nerve with a gentle hand on the olfactory nerve or olfactory tract. And in this we can add the neurodynamic positioning, this long sitting positioning, and we can add the symptoms with the foot and ankle change of movement according to the slump position. That is also a very great view of using the olfactory nerve, because we know that the olfactory nerve, the smell, either the pleasant smell or unpleasant smell, how it affect with the neurodynamic conditioning. And we can give the vomeronasal organ massage also. We can give this gentle massage on the particular place with the gentle strokes, not so much of harsh hands. So it was a very great view. We can add the cervical portion also for the changing the to see the change in the symptoms also according to the pleasant or unpleasant smell of olfactory nerve. Then we move towards the optic nerve, and when sir has started about the all the optic nerve and the nerves related to the eye movements, sir has shown a first a very great view of external ocular muscles, which are according to that we have planned our treatment for the optic nerve. Like we use for the optic nerve and optic chiasma and tract, we use the neurodynamic condition also. For the elongation of optic nerve, we use the contralateral neurodynamic, and for the chiasma we used, and the tract we use the same side neurodynamic positioning. That was also a very great view, and we have done our testing with the direct test on the eyeball and the return test. After that we can check that the movement of nerves. We have added visual tracking, we have visual field checking, we have tracking for all the dysfunction of optic nerve we have seen in the neurodynamic positioning. That was also a very great view. Then we have started the external ocular muscles, like superior rectus muscle, inferior rectus muscle, obliques, lateral rectus, medial rectus. According to that we have planned our treatment for the cranial nerve, trochlear, oculomotor, and abducens. So for that we have used the cranial neuromanual therapy according to the neurodynamic positioning also. How we can check the splint because of the lateral rectus, and for the medial rectus, if there is a dysfunction, the squint is on medial side, the how the lateral rectus we can give the treatment in the neurodynamic position. And for the diplopia we can use the trochlear muscle, we can use for also the superior oblique and inferior oblique. For the extorsion and intorsion of the muscles, we can check all these things in a neurodynamic positioning, as well as we can give the myofascial release around the muscle. And here the role comes for the supraorbital fissure release, it comes. And we have checked all these things on the supraorbital place, in and around the eyeballs, and for the cortex also we can check the mechanical stimulation with the help of tunic fork. So this was the very great view of all the cranial nerve related to the eyes movement, how the neurodynamic positioning, the neck movement, offloading and loading of nerve helps in treat the cranial nerve of eyes related. Then we move towards the trigeminal nerve. That is also in this the superior part of trigeminal we covered. For the optic nerve we use the optic part, then with maxilla and the maxillary range and the mandible, that we also used with the neurodynamic position, with the rotation of the cervical, upper cervical, lower cervical flexion, and then the rotation of neck and the lateral flexion of neck. And in that we can also add the bilateral leg movement, we can also add. And then we can treat all the branches of trigeminal nerve, that is the biggest nerve, so we can use it. Then we move toward the facial nerve, which is very much real. We all know that the facial nerve, that all the muscles are related each and other. If there is a one dysfunction in a one muscle, all the muscle we have to treat continuously. So here we can use the IASTM also to separating the layer, and in the neurodynamic position for the facial nerve, like we will say that the upper motor neuron lesions or lower motor lesions, that we treat with the neurodynamic position with the head rotation, cervical flexion, lateral flexion, rotation, flexion. Then we use neck rotations and the lateral flexion to treating the lower motor neuron dysfunction. So this is also a facial release. There we can check the trigger point on the facial. We can use the PNF here also. If the patient is not there is a problem that not opening the one eye, then we can use the PNFs to give the irradiation to the particular muscle. So that is also, and yes, we can use here the MET also. We can use the reciprocal inhibition. We can also use all in this cranial nerve therapy. We can use the MET and the myofascial release, and simultaneously we will instruct the patient to for the breathing pattern also according to the post COVID, long exhalation for obstructive and long inhalation for the restrictive pattern. So that is also a very major part for treating the with the breathing pattern also. Then we move towards the vestibulocochlear muscle, that cranial nerve, that is also very important. We have to check that there is a problem with the vestibule, the balance, or the cochlear for the hearing. So we have to check according to the mechanical sensitivity with the tunic fork to keeping on the head. And we can first differentiate between is the either the problem with the vertigo, VBI, or there is a positional vertigo, that we rule out. After that we treat for the hearing. Here we can give almost the after the foramen magnum release, we use that petrous release we use. So these are the we can palpate on the mastoid also. So there are many techniques for using the cranial nerve with the neurodynamic conditioning itself. We can check is the function dysfunction in a one side, that is the tensioner dysfunction. If the opposite side is a slider dysfunction, so according to that we can plan our sliders and tensioner also. That is also a very important part of this cranial nerve. Then we go towards the hypoglossal and glossopharyngeal, that is also for the speech, swallowing, snoring. There are so many dysfunction related to these muscles. So because they are tracked with the L shape with the same like the mandible, so we have to give the release. We can give the protrusion, retrusion of the tongue according to the muscles which are related for taking the protrusion, retrusion, and taking the tongue down. We can check the myofascial trigger point there. We can release with the faciomuscular release. We can give the opposite side the offloading of nerve. Then we can check the gag reflex. We can also check with the bird. So there are many things which we can check in the offloading position, and after in the progression we can use in the nerve loading position. That is also very I think important part of cranial nerve treatment. Then after that we move towards the vagus, and that is the main long cranial nerve, which we all know that it goes towards the for the visceral organ. We use for the vagus nerve. So first we have to check the place, the particular place where we have to palpate. So we have to check with the carotid artery and the jugular vein. So we have to, here the picture comes for the jugular foramen release, it comes here because for the vagus or accessory nerve. So this is also a very important. Like this we can use all the visceral organs according to the site, which side of vagus nerve affecting the liver, which side is affecting the heart. So everything we have to check. Then we can plan with the breathing pattern. Here we can plan with the breathing pattern also, inhalation, exhalation, according to the force which we can give on the particular on the nerve or as well as on the visceral organ. So that is also a very important part of this treatment. So overall all the 12 cranial nerves sir has shown a great view. It's just some points which I am sharing with you, because there was so much detail of this course which I cannot express in my words. So I will request you to all whomever wants their skills for the upgradation, they can join this course. They can take the videos for AMPT, because it's one of the best course which I have seen, because it's beyond our imagination. It was wonderful view of each nerve, each view, how we can the small muscle we can give the myofascial release, MET. In the neurodynamic condition we can provide for the small muscle, how we can provide the sliders and tensioner. That is also a very important role. and the tunic fork, use of tunic fork, how we can use them for the mechanical stimulation, and all these muscles, the offloading and loading of nerve, how it affects in the progression, how we can add the cervical movements for the betterment of the patient. We can check in all the nerves in a loading or offloading position. That is a very great view. So I am feeling blessed after attending, because we are the student of first batch of this type of course. So definitely we will use for the case studies, also we will use for patients, and then we can submit our details to our academy AMPT, which is the best academy, and our mentor Dr. Santhil sir, who is the great teacher, who can guide you in all the direction, not in a single direction, not in a manual therapy, for the neuromanual therapy. Now the topic is very new, that is the cranial neuromanual therapy. So thank you so much, Dr. Santhil sir, for giving us a wonderful view of each technique. Each session was worth. So thank you so much, and thank you everyone. So please join this course. That will be the best decision of your life. Thank you so much.